had individual that came in today, and she's very thin, fit, but where she had her tummy tuck 10 years ago, she has that divot where probably too much either tissue or fat was removed right below the line. Really, really bugs her. Is that an area she wants to know that can have filler?
Oh. So when you think about a tummy tuck, the scar extends through the entire fat layer. So it's not just the scar that's very superficial, but it extends through the fat layer. And very much is there a chance, particularly if you feel it's very much bound down, that once it healed on top of the muscular fascia. That's the layer that covers the muscle so that the muscle can contract freely, but the fat above or the skin above is not really doing anything to it. So the fascia is that membrane on top of the muscle. And so I think these scars are difficult to repair. So if you're trying to put filler underneath there, that means you have to first create a space underneath there where you put that filler. And I think that's pretty much impossible. You would have to go with a knife or whatever, the instrument, underneath the, inside the scar, into the scar, create a subcision that's along that in the form of a tunnel where you can put a filler in. If you think about the scar differently, you might think, what kind of laser could you use in order to undo this kind of depth and to create maybe a lesser contraction in the scar? And when I think about that kind of scenario, I think about a CO2 laser. Of course, there is a very, very limited depth to the CO2 laser. You cannot use this endlessly and think something magical will occur in areas where a scar might be a centimeter thick, because the CO2 laser, in the best case scenario, when we're tricking the Deca laser to do what we want it to do, we can reach about 6 millimeters. And maybe those 6 millimeters might be sufficient for the patient to notice that the scar kind of loosens itself up. So I use typically fairly aggressive settings in these kind of divoted scars. The most aggressive that I can dial, the Deca laser, I go directly into the scarred line. I usually do about 6 kind of passes with a very, very skinny dot. For that, I don't even have to numb the patient, because each dot is so skinny that the patient typically does not experience pain. So in other words, these are very intense, but so skinny entry points that pain in a scar is not usually an issue that I have to deal with. This could be an option. Now, I'm not really sure if it's going to work for the patient. It would be easier for me if I saw the scar. Do you happen to have a picture?
Yeah, my phone, but it's not on the scar. It's on the, like the mons pubis. So it's right underneath the scar, below it.
So what kind of depression does she have underneath there?
So it sounds exactly what you were saying when did the skin adhere to the fascia? Like there's like tissue paper and it's just on it.
I see. So again, I was thinking about a scar that kind of just caves in like this, but that is not what you're saying, right?
The scar's perfectly fine. She's not bothered by the scar anymore.
Mm-hmm.
I'm not sure. Let me see if I can.
Well, this is, if she wanted this to be smoother, fat injection would be the better choice.
Yeah, I was wondering about fat. Okay.
Yeah. So filler would not be, I think the consistency of filler would not necessarily work in that area, but very natural results should be able to be achieved with fat transfer.
Okay.
And the interesting thing is, during the fat transfer, the cannula can also be used to loosen up some of that tissue, right? And it's like a one type of subcision in order to create a more favorable contour in this area. So I would be in favor of fat transfer for this area. Okay, so scratch everything that I said about laser in the in these kind of.
Still valuable information, just doesn't pertain to this gal.
Does not pertain to the scar.
Yeah.
Yeah.
Okay, perfect.
Good. Okay.